Okay, good morning, guys. I've got something interesting to talk about. Patients frequently ask before surgery, before facial surgery, whether their smile is going to change. And patients sometimes note afterward, or at least have the perception that their smile has changed. Let's first talk about what we mean about facial surgery, because it seemed to be four procedures that we hear about when patients are asking in advance or when they're talking about it afterwards. And those four procedures are facelifts, lip lifts, rhinoplasties, and genioplasties. So, of course, a facelift, most frequently a deep plane facelift, resupports, elevates, releases tissues and places them in a more natural position, a more youthful position. And those are the tissues of the cheek. Okay. Now, a rhinoplasty obviously is surgery of the nose. The nose is located here, right above the lip. You see where I'm headed with this, don't you? All right. A lip lift literally is operating on the lip, and genioplasty is an operation of the chin. So let's talk about the fact that, yes, there is the potential to have a change in your smile when you're undergoing one of these procedures. Now, I want you to lean into that reality and recognize that that is not a bad thing. Why is not a bad thing? Well, first of all, just from a very, very basic aesthetic sense, when we look at the overall face and it has been improved because one feature has been made better, one feature has been placed better in balance with the rest of the face, which is a really important element of shape surgery. When that has happened, all of the features have a little bit more of a sparkle. They look a little bit better. So the reality is that when people see you after these procedures and after they have healed, people are seeing a face overall that is more pleasant, and every element of it, every feature of it is going to look a little bit better, including the lips, including the smile. So again, the answer to the question is yes, probably, but it's not a bad thing. It's very often a good thing, or at minimum, a neutral thing. Now, the other thing that I want to point out is how that might come about, how an actual change, not just a perceived change, will come about. Well, when we think about a facelift, again, a facelift works in the soft tissues, primarily in the cheek, if we're thinking about the classic central facelift. Not the brow lift, not the neck lift, but the classic central facelift. That's working on the cheeks. And the cheeks, of course, are attached to the lips. So if you're repositioning the cheeks in a vertical oblique vector, you're going to raise the corners of the mouth some. It may be subtle, it may be really quite natural but profound. Now that is, again, a good thing. If you're starting off with a mouth when closed that is straight, it's going to make it easier to have a beautiful, natural, youthful smile. Before the facelift, remember, sometimes the mouth is like upside down frown. How can you go from an upside down frown to a really nice smile as well as you can when we're starting off with a more youthful, straight line appearance to the lips when they're closed? So that's an important thing to recognize. A second thing to recognize is that a lip lift literally is an operation that lifts, shapes, shortens a long lip. Now, it makes a lot of sense that if we're thinking about the smile as the way that the upper lip and the lower lip move when you have joy, when you laugh, when you see someone, or when you're trying to convey joy, it only makes sense that if you're shortening the upper lip in a very precise fashion to shape the lip, it's going to change the smile. I don't know that there's much more that needs to be said about that, except that, again, this is one of those examples of where it is a good thing, right? We're trying to change the lip, trying to make it more youthful. It's going to enhance the appearance of the smile. In particular, when done very well with calculated numbers, the goal is to go from a smile where you can't see the teeth, that is referred to as a edentulous smile, meaning you don't see the teeth, especially the upper teeth. Sometimes you see the lower teeth, and we're going to get to that when we talk about genioplasty, but you don't see the upper teeth when you smile. But when you shorten the lip an appropriate amount, when you smile, you see the bottom part of the teeth. Goal is to be about 2 to 3 millimeters. That's a very youthful appearance. Now, you don't want to shorten the lip too much because then you can create a gummy smile. But the way that it's generally performed, it's a very calculated operation that brings about a very natural relationship. Let's talk about rhinoplasty because that's the one that's a little bit more confusing for patients, I think. They wonder why when they've had a rhinoplasty, they might have some shape change in their smile. Now, this is the example where that change is temporary more than any of the other three examples. And the reason it's temporary is that a rhinoplasty has very little direct impact on the muscles and the skin of the lip, of the upper lip, and therefore has very little long-term changes in the smile. A lot of patients have this notion that a muscle has been cut. That's kind of old information. Very few people actually cut the muscle in this region, cut it deliberately, cut it in a way where it doesn't work. And that was something that used to be done in order to change the angle between the nose and the lip. And sometimes it still can be done for strategic important reasons. But in most rhinoplasties, that's not done. So there's no significant alteration of the muscles of the lip or the muscles attaching to the lip when we do a rhinoplasty. The reason that a rhinoplasty can change the appearance of a smile temporarily is that the swelling in the tissues around the nose aren't just in the nose. Again, they're around the nose. They're in the cheek. They're in the upper lip. And that swelling makes the tissue more rigid. We call that turgid. It makes, there's a turgidness to that. It makes the tissue stiffer. And when they're more rigid, when they're stiffer, they don't function as well temporarily because they're kind of fighting against the stiffness. When the swelling goes away, and we know that in rhinoplasties, 40% of the swelling is left at 3 months, which is to say that 60% of the swelling goes away at 3 months, a lot of it in the front portion of that recovery first couple of weeks. And we know that the remainder of the 40% goes away over the time between 3 months and 12 months. When that swelling goes away, again, most of it in the up front, front-loaded, the tissue becomes less rigid, less turgid, and the smile is able to become more and more normal. Could there be micro changes in the smile? Potentially, and I'm going to address that in the second portion of what I'm discussing. But the rhinoplasty, again, is the location on the face where surgery has the most temporary change. Let's talk about genioplasty because it's the fourth of the 4 procedures. Why would a genioplasty change the smile? And why is that a good thing in almost all cases? Well, first of all, genioplasty can have temporary changes and it can have permanent changes. Permanent changes being good, temporary changes likely being normal or natural is really a better way for what I was saying. Meaning natural, it's a natural consequence temporarily of surgery. Again, that has to do with the swelling. Now, a genioplasty can take 3 major forms. One is adding a chin implant. One is doing an osteoplastic genioplasty, meaning cutting the bone. 1A, the second of the 3, is making a cut in the bone and advancing it to make the chin a little bit longer. And the other one is cutting the bone in 2 locations, taking out a small wedge and bringing the chin back, sliding genioplasties both forwards and backwards. Now, those procedures do change the appearance of the smile in a specific way and in a positive way in some cases. A genioplasty where we're creating more bony support or adding an implant can help prop up the lower lip, can help reposition it in a favorable way so that when we smile, we actually cover a little bit more of the lower lip, of the lower teeth. That's really important when we were dealing with a patient who's a little bit older. But people who have weak chins often have a difficult time closing their lips, even have a straining appearance with dimpling in the chin when they go to close their lips. And it's even more pronounced, that lack of coverage of the lower teeth, and the strain is even more pronounced with a smile. Many people with weak chins sort of avoid smiling or smiling as strong, but when you augment the chin, when you give a little bit more support, they feel like they have a much more natural, a much more engaging smile. So those are the 4 procedures, and a description of how those changes may be, whether they're permanent and positive or whether they're temporary and neutral. Now, let's go on to the whole nature of the smile in general. This is a really important issue because perception is everything, but we can have discipline and understand the way we perceive things and allow that, again, to help create a reality where we embrace change with joy, with happiness, leaning into that reality. But it's important to recognize that, again, perceptions sometimes do not entirely relate to the truth, okay? So they don't always. And this is such a key factor when it comes to the smile. Smiles are a very dynamic, emotional expression on the face. Sometimes they can be big, sometimes they can be small. When we're tired, they're not as big. When we're energetic, they can be bigger. They can be more engaging. The amount of energy we might have also relates to the nature of our smile. What we're responding to, whether it's natural, whether it's deliberate in order for having a photo or conveying a welcomeness to someone we're meeting who's new. There's so many factors, including physical ones, whether for some reason, whether we're swollen, maybe because we ate a lot of salt or did something that was inflammatory. All of those factors work together to create very different smiles from day to day, from time to time. And I like to tell patients that we basically never have the same smile twice, that there really are infinite numbers of smiles. And so if there's infinite numbers of smiles, even after surgery, we're not going to find a smile that exactly matches all of those smiles that they had beforehand in all of the pictures. So sometimes patients, even once all the swelling has gone away, will say, look, my smile is subtly different. And my comment to them is go back and look at a bunch of photos before surgery and compare them. And you will see that you've actually never really had exactly the same smile. So when they understand that reality and they prove it to themselves, it no longer becomes a concern. Another thing that happens after surgery is patients will try to see if their smile has changed with very forced, very deliberate, and therefore unnatural smiles in the mirror, trying to explore how their smile may be different. And when you try to test something like that, when you're looking for a difference and it's something you can control, you do that thing. You make that smile in a way that is exaggerated, really trying to explore the limits of it. Well, that's not what a natural smile is, certainly not a natural spontaneous one, but even a natural smile where you're just trying to convey happiness, a welcomeness. When you're trying to look for a change, you are gonna find it, okay? And so I'll see patients who do all sorts of sort of unusual smiles to try to see if it's different. And once I point that out to them, they're like, oh yeah, I get it. And what I usually do is I help explain to them, hey, listen, if I told you a joke, if I saw you for the first time after a long time, if I tickled you, you would have a smile that looks much more natural. And sometimes I'll just ask them, hey, smile, I'll take a picture, I'll show them, and they can see that they actually have a much more natural smile than they think they do, even early after surgery. That's an important technique. And then someone on my team told me about this. This is awesome. If you put your tongue on the roof of your mouth when you smile, and it's a deliberate smile, it automatically makes that smile look more natural. So we also go through that exercise with patients as well to help them understand. So again, in summary, the bottom line is that surgery might create small changes to a smile. Often they're very good changes. Lean into that, embrace it. Like that fact, because that's part of what we're trying to do. Use one procedure perhaps to improve the appearance of the overall face. And then also smile changes that you see after surgery, especially in the early part of your recovery, are not going to be permanent changes. They're the most changes that you're going to see once the swelling goes away. They're going to diminish. And then the final thing is, if you try to look for differences in a smile by doing a very unnatural smile, you're not going to find a normal smile. So don't stress yourself out. And the final thing is, in a way that's so beautiful, so wonderful, we have infinite numbers of this great thing called a smile. And you're never going to find 2 of them that match completely, whether it's 2 before surgery, 2 after surgery, or if you're comparing before and after surgery. So there we go. And really important, happiness-focused education on smiles and facial surgery.